on the Expression podcast, we welcome Dr. Muthu Kumar, a trailblazer in holistic healthcare and one of India's leading acupuncture specialists. With over 40 years of experience, Dr. Muthu Kumar transitioned from allopathy to acupuncture, training in China, Singapore, and earning global recognition for his groundbreaking treatments. He has helped thousands overcome chronic conditions including diabetes, stress, autism, using a holistic, needle-based approach that challenges modern medical norms. Founder of Acuboutique and MIAH and a passionate educator, he continues to inspire and heal while making acupuncture accessible to all. Please join us in welcoming Dr. Muthu Kumar on this Expression podcast today. Thank you, Doctor, for being here.
Thank you. It's a pleasure for me to be with you there.
Thank you so much. I'd like to begin by asking you that what sparked your interest in the field of acupuncture?
Well, actually, sir, when I completed my degree, my medical degree, then I started the practice in Kumar. That I was actually, with all into, I was practicing. But very unfortunate, those days we used to get 5 rupees out of the patients. And place where I was practicing, they love me like anything. They treat me as their own son. But each and every time when I practice for diabetes, asthma, polio, arthritis, low back pain, neck pain, then autism, migraine, sinusitis, psoriasis, vitiligo, eczema. You tell me how many number of... For all these conditions, you do not have a full, complete treatment in allopathy. That made me very much upset because I'm really justified getting money out of them.
Yes.
Because I don't treat them. I'm just making them not to feel the problem. A person comes with the arthritis. What I do, I don't give him anything. I give him an analgesic. By taking the tablet, he will not feel the pain, but the problem will be there.
Yes.
So I'm really justified.
Yes.
This was a question that was completely, undergoing in my mind. That time I met a doctor and I had an opportunity to present paper in Indian Medical Associations. So the paper, because I was presenting the paper, I was made to sit in the dais. That time the organizer brought an old man and they said, Dr. Muthu, kindly take care of him. He's an acupuncturist from China. Believe me, in those days, in 70s, we doctors, we hated respect. Whenever you go to the wedding hall, everybody will be standing. We don't even go to the banks. We just give a call. They will come and pay us the money and get the check and go. If we want to go for theatres, they will be waiting. Till we come, they will not screen the main pictures. These are type of things we were enjoying that time.
Oh, yeah.
So when I started seeing a man telling that he's an acupuncturist, I was very furious. I was only 28 years old. So I abused it, started abusing it. The conference was on, somebody is presenting a paper, I'm sitting next to him, and I was completely, by closing my eyes, I was abusing him. You idiot. How come you don't have a God fear? How come you're deceiving the public? Take it, put it somewhere, it becomes normal. What is the scientific background? All this, I was completely banging him.
Yes.
He said, Doctor, are you a medical doctor? I said, yes. Can you define me? Angina pectoris, that is heart attack. I said, you are a non-scientific man. You don't understand. No. So you kindly tell me. Let me know. This is a precordial pain. This area is called as precordial. Precordial pain. Pricking in nature. Radiating through the middle part of the hand and more felt at the tip of the little finger. When he told him, he said, Muthu, 100 marks award to you. But could you kindly tell me when you got a problem in that? How come you got a pain in the little finger? I was out. Because when as a student, when I asked the same question to my professor, what the answer I got out of it? These are all referred pain. Problem will be somewhere, it will be manifested somewhere. All of us know these are all gimmicks. We know, but we do not have any other answer, so I accepted. So I told him, referred pain. Believe me, he was just rolling down and he was laughing at me. I was upset. Hey man, look here. I know my limitations. You tell me. I was very confident he could not tell that any answer for me. Believe me, he took one photograph of the heart meridian. Heart meridian starts here, it runs on the medial side, ends in the tip of the little finger. And he said, Muthu, you take a wire, potential will be more on the end and moderate in the center. That is the reason you got more pain here and less pain here. I was totally taken aback.
Yes.
Because I always want to teach us. So I said, very sorry, sir. I apologize. Because I never knew something. I'm so sorry. Then I never want to face him at all. Again, he called me, Muthu, gents and ladies, who are using more spectacles? Sir, honestly telling you, this is not taught in allopathy. Because I didn't want to get it cut. He said, why don't you make a guess? I was thinking of them, my friends, relatives, patients. Gents are using more specs than the ladies. I told him gents. He said, why, Muthu? You, a gent, you are coming out, working in the field, in daylight. Ladies are sitting in the huts, exposing to cooking gases, ill-illuminated. It should be the other way. I'm really so sorry, sir. He took another photograph here, but believe me, as a medical student, I would have conducted more than 500 deliveries as a medical student and a house help. But till my professor told me, it didn't get me to my mind at all. It never struck me. Have you ever seen this eye ear? You see this ear? He told me exactly this is how a fully grown fetus will be coming out of the mother's womb. You see this? The head, the trunk, it's huddled back. I was stunned actually.
Yes.
For in allopathy, sir, we know only for collection of sound waves and cosmetic reason. Nothing more we know.
Yes.
And we need to tell for the teacher to squeeze the why it is there, it is only for that one. It's called as pinna. Nothing more we know in allopathy. But when he told me that one and said, he took a photograph of that one, this point is exactly for eyes. So all ladies, they use earbow, bimetal. All time your acuity of vision will be more. He said, Muthu, that was the reason your old people, they were all using kadukan. And in each and every houses, they conduct ear piercing ceremony.
Yes.
You think of old pirates and warriors, they'll be using a ring in that neurosin.
Yes.
Now, before they invent the binocular, the vision, they should identify the enemy very early. When he started telling me, I bowed down. He said, what man, you are talking me something which I do not know.
Very fascinating.
Then I was running after it for 3 months. Wherever he'll go and meet him from Kumbhakonam, I'll go, take a flight, go there. He was in Mysore, he was in Bangalore, he was in like he kept on moving. He was on a transit in India. This all happened in 1982. Then when he was in Nagpur, repeatedly I went and met him. He said, now Muthu, I understood you are really interested in learning. Then I'll teach you.
Yes.
This is the way he came out of it. Totally shifted.
Okay.
But believe me, even after having the degree here, you took me 2 years to convince myself.
Yes, and I also know that you practice without payment.
How come I can know? Sir, any book I give it to you,
Yes.
you get easily 50 marks.
Yes.
But does it mean it will work? How come I can say? Because I'm going to collect money for the patient. So what I did, I selected people. Asthma people, you come. Yeah, 2 people from arthritis. You come. Likewise, I picked up people. I told them, look here. How many times you come to me? I will keep on changing the drugs I'm giving to you. It's not going to be make you better. But now I learned a therapy. They say it may cure, but I do not know. Because I'm not confident.
Yes.
You have to come, but you need not pay me. Yeah, you need not pay me. You come free of cost, but you should come very regular. So that next to God, I should be very thankful to my Kumbhakonam patients. Without any gap, they came. First time when I found result, I said, no. This is a coexistence. Second time, no, I don't accept. Third time, whether the good enough to believe, it becomes a science.
Yes.
Each and every time when I see the result, that was, it took me 2 years. I never put it on the board, never collected money from the patient. But after that, slowly I started exploring what acupuncture is.
Yes.
So far, I have read more than 400 books in acupuncture. I traveled a lot, worked with Chinese people. In 95, I was for a whole year, I was in China. I did my PhD in Singapore. I was there in Singapore for 2 years. Then in Vijaya Hospital, Chennai, I had an individual exclusive acupuncture unit for 26 years. And I should be very thankful to God and my very patients. They only taught me acupuncture. I can tell you that.
But it's been, your results are very amazing, doctor.
Yeah.
It shows immediately and we recover from our conditions.
Absolutely, for India, it's a best
It's
thing.
magical, yes.
Yeah, I'll tell you what you got.
And you were talking about books, that you read many books. So I would like to know that, is there anything that changed your perspective, any new learnings, any new research?
Sir, in allopathy, sir, though we were taught so many things, certain basics we do not know. Certain basics, I say. You take a deep breath in, you do it, take it. You put it, you send it out, you exhale. If I ask you what is active, which is passive, either taking in or taking out, which is active? You taking in and you send it out.
Yes.
Which is active, which is passive? Anybody will tell taking in the active.
Yes.
But very unfortunate, acupuncture doesn't say so. Yeah, because there is abundantly present atmosphere there. when you inspire, what happens? The diaphragm will go down. So there is creates a negative space. So automatically the air comes and goes inside. From expiration, you've got air here. Already there is existing atmosphere here. You have to push it out. That is active.
Yes.
That is the reason in asthma patients, inhalation will be normal. Only exhalation they find it difficult. These are all kuti vishayangal, sir, that tells us something different. Totally, the approach itself will be very different.
Yes.
We do not have any treatment to touch the pancreas. But believe me, you got a point for pancreas in acupuncture. Here. When you touch the point, pancreas has to grow. There is a point for the secretion of insulin. Automatically, the insulin comes in the bloodstream. So we treat diabetes.
Yes.
Worldwide, they are talking about diabetes is controllable, not treatable. But we treat completely. So far, more than 5,000 recorded cases I got. Now they are living without drug and within normal diet.
And you also mentioned, Doctor, that some latest book that you read, it spoke about the different kind of tears, different kind of nasal.
Thing is, sir,
throw
this
some
is
light on
something
that?
unbelievably they are good, sir. Honestly telling you, this is not Chinese acupuncture. This I want to emphasize. This is a Vedic acupuncture.
Okay.
I have done so much research. Though the yin-yang pattern was told in Book of Changes, which is 8,000 years old. But the five elementary me, other concepts, they are not told till 2nd century AD. Only in 2nd century AD, all these concepts came into these things. When I went deeply, when I started doing researches, have you ever heard of Takshila? It was a university which was started in Takshasila.
Okay.
Why Takshasila? Takshan is a son of Bharata.
Okay.
And they got a big university and it is with the hostels.
Okay.
They come, they stay, they learn so many things. Even Alexander visited that place. Takshasila. There you had umpty number of scrolls, the plants, everything they were holding.
Yes.
At that time, so many people came down. And you know Ashoka suddenly he changed to Ahimsa. So he said there should not be any surgery at all. So to treat a patient on putting a needle, it could be done, it was start in Taksila. So he took it to the everywhere. He sent his own son to Singapore, Ceylon, Mahinda. Mahinda was sent to Ceylon. In Ceylon, it's called the Pilicium. So from there, people started going for China. In China, the particular man, Kuan, he was a man who propagated the five element therapy, which is the base of our. In Ayurveda, you got 8 branches.
Yes.
One of the branches is Salyaveda.
Oh.
This is a part of Salyaveda. Salya means needle. In Rigveda, it is beautifully given the name of Suchi Sigicha. The name of Suchi Sigicha. Suchi means needle. Sigicha means modality of treatment.
Yes.
It is clearly given. So I will say this is a very acupuncture. From India, it gone everywhere.
Yes.
Ah.
Beautiful connection.
Yeah.
But both acupuncture and Ayurvedic practices involve the science of acupressure. Would you
No.
agree, Doctor?
The acupuncture, I would like to
Yes.
tell you the difference here.
Mm.
Usually, the Indians and Pakistan, we don't go to them.
Yes.
Likewise, in the world, you can see it. The England people and Austrian, they don't never go together. Because they think these are all culprits.
Yes.
You know the history.
Yes.
Under Tapas Cook, all the prisoners, they will be sent for isolation.
Sure.
So they don't accept these guys. Likewise, Chinese and Japanese, they don't go together.
Uh-huh.
If they talk about Chinese acupuncture, they say Japanese. If they talk about Chinese judo, you can talk about the Japanese judo. Likewise, so this is acupuncture, 10,000 years old.
Okay.
In 1915, one Japanese, the name of Siyasu,
Okay.
he brought in the acupressure.
Okay.
So both of things are really to me, sir.
Yes.
I am not siding one thing.
Yes.
But basic, I am a scientific man. You should convince me to follow some therapy. In acupuncture, what do they say? You got different points.
Mm-hmm.
You take a needle, put it exactly over the point, try to release the block, so that you regain the flow of energy. This is the basics of acupuncture.
Okay.
So by doing this, it goes for 15 days, 30 days, 45 days. It is not overnight.
Yes.
But in acupressure, what do they say? Nothing. You take your finger, you put it here, do like this, it will heal everything. Scientifically, I cannot accept all those things. And that is the only reason I don't accept acupressure. Acupuncture is 10,000 years old.
Acupuncture and other alternate treatments are now moving to mainstreams.
Yeah.
What is your thought on that?
Completely, the day by day. Once the patient goes, what is the current prevailing situations? When you go and meet any doctor, immediately he gives you all tests. They have to go take all the tests and go. Every test are expensive nowadays. After getting all the things, you give it back to the doctor. Doctor goes through everything. What he'll ask the patient, yes, what is the problem with you? It's a very sad. I'm not joking. It's a sad thing happening even today.
True.
Which are all the tests positive? They go for a medicine. They give it to the patient. You are just treating the symptoms. Where is the question of diagnosis? In our time, when we were students, only 27% will be passed. They will give pass. Whatever be there, how better you are written, they will not bother. They will give only 27. After that, you are failed. After Corona, people are scared about this allopathy. So slowly they are coming to us.
Okay.
And here, we make our diagnosis looking at the eyes. You're going to spend any money for investigation. No tablets. You come here. Under that, when you give after a paracetamol, it has got a side effects.
Yeah.
Acupuncture, no side effects.
Absolutely, doctor. And it's also addressing the roots of the problem.
Yeah. We treat the cause.
Yes. We also notice through some research that Maharashtra is catching up rapidly to acupuncture.
Yeah.
So what do you feel is the reason why South Indian cities are not, the acceptance of acupuncture is not...
No. I would like to entertain this one because it so happened Tamil Nadu has got more number of acupuncturists. But very sad and people who are not literally qualified.
Yes.
I feel extremely sorry to tell this, but this is a fact, open fact. Unless you know what is normal, how come you say something is abnormal? But one should have a basic knowledge about anatomy of the body, physiology of the body, and pathology. Pathology tells you how the disease comes and goes.
Yes.
But unless you know that one, how come you can become a doctor? In 3 months, anybody can become a lawyer or advocate or an engineer or an auditor? Nothing, not possible. But in Tamil Nadu, within 3 months, even if you are a plus 2 failed, finish, you can become a doctor. That is a very sad part. But in North India, not only in Maharashtra, total North India, all doctors who have completed Siddha, Ayurvedic, Homeopathy, after completing the study, being a professional doctor, they learn acupuncture. But the problem is, in Tamil Nadu government, they are not doing that one. Though from 2008, we got a committee, it's called a National Coordinating Committee. We are 8 members. I was representing South part. Even today, we have kept on moving to this central government and made the, thank God, only 2 months back, our Honorable J.P. Nata, he recognized acupuncture and gave a GO stating that acupuncture is recognized as an individual modality of treatment in India. So
Excellent.
job is done.
Yes.
So hereafter, the growth will be something different in all the states,
Absolutely.
not only in Maharashtra.
And many people will benefit from this. Doctor, you also spoke about how you see the person's eye and diagnose the problem. How did you get this unique gift and what is this about, if you could elaborate?
So this is called as Iridology.
Yes.
Iris means a black eye.
Yes.
Logos means study.
Yes.
Biology of study of life, like the Iridology. This is 10,000 years old. Sir, in all the religions, sir, they are talking about this one. Only after having learned, then I came to know. Bharati, the great Sam, white Bharati,
yes.
He is literally inviting the young guys to fight against the Britishers. About how he has written, he is actually inviting people, particularly young guys. What is this? Kayavisi to no. Come with the chest. No, not like that. Oli padaitha kannina you want. What does it mean? Only the bright eyes. That means he has got blameless. No blemish in him. He is healthy, healthy. Those people only fight against the people. In Bible, if you go and read in Matthew 5, 5th chapter, exactly it has been given. Kanne sariratin vilakkai irukkirathu. All the body, all the organs of the bodies are depicted in the eyes. On just looking at eyes, I not only your physical problem, but I can also tell the quality of the patient, particularly the emotional part. Because in allopathy, we talk about the physical ailment. But actually, in acupuncture, we talk about 3 planes. More than the physical plane, you got an emotional plane. Once your emotional plane upsets, it will be manifest in the physical plane. At that time, whatever treatment you give physically, nothing will not act. You have to correct the emotional part. More than that, you got a spiritual plane. That corrupts. In turn, your emotions will be corrupt. In turn, you got a problem. All the skin problems, constipations, asthma, these are all spirit affected people. We know only Navarasa. You know that? Only 9 emotions. But in Tibetan medicine, when I happen to go through the thing, they are talking about 84,000 types of emotions.
Oh my God.
84,000, believe me. When it exceeds, you got problem. When it deficiency, it will have problem. So altogether, they are charted out 168,000 diseases.
And I don't think in conventional medicines, they address a person's problem seeing the emotions. It's always basically just addressing it physically.
We were not at all taught
which is
here
the
in
most crucial
allopathy.
part, actually.
In allopathy, we are not taught.
Yes,
So
absolutely.
something we are not taught, how we can say. But here, the emotion very important.
Yes. Doctors really don't see, and even sometimes patients don't see the benefits of this treatment. So is there a communication problem, do you think?
In those days, there was a question of trust.
Yes.
They trust the doctor
Yes.
completely. We were very sorry to tell after this word.
Yes.
They treated us as a demigod. That was the day. What? But everybody is very fast.
Yes.
If somebody takes here, immediately they will see whether it has come or not.
Yes.
They are very fast.
Yes, and they'll immediately go on
Immediately.
Google and see
Yeah,
whether
whatever, everything. They
Yes.
want instant release.
Yes.
But no disease, instantly it goes.
Yes.
They should understand. Sir, fever, sir. You take a paracetamol, it goes out.
Mm.
Everybody is happy.
Mm.
But fever is not a disease. It is a manifestation of something, pathology that is underlying inside your body. Because that thing, your fever has come. Tiruvalar has clearly said, Noi Nadi, Noi Mudal Nadi. You should treat the cause, not the symptoms. But the main part of the doctors, particularly acupuncturists, you should explain them why it is taking a long time.
Mm.
Once you convince them, then only they will come. You should tell them why it takes some time.
And have you been successful there, doctor?
Absolutely.
Okay, you've seen the changes over the years?
Absolutely, sir. Since 5 years, sir, I put less effort in convincing patient.
Okay.
In those days, they will not tell about their problems at all. They will come sit and they'll ask, Doctor, what is acupuncture? They will ask me. But patiently, I will be explaining them, this is acupuncture. Then only they will be telling their complaints. But here, now, not. Most of the people, they know, yeah.
How soon do the patients feel improvement when they go through the acupuncture therapy?
It depends on the therapy, the conditions.
Yes.
If some patient comes with insomnia, and if within a week's time, I can bring them to normal. They feel elated. Doctor, how come now I sleep a lot? Even the time of needling, I put down, somebody will snore. That we can do. But for poly people, it takes a long time.
Yes.
For a diabetic people, within 22 days, I can taper half a tablet. I can taper. I'll explain to you later how it's going to work at that. For autistic child, 103 days. But we can put them in normal school. No exaggerations.
And are there any conditions where you shouldn't take needling, doctor? Where you shouldn't fever or pregnancy? Are there any?
In our units, what we do, in the conditions of cancer,
Okay.
the conditions, cardiac conditions, I don't test.
Okay.
But doctor, don't you have any treatment for that? No, we have. But you are living in a community where these two diseases, cardiac and cancer, at any part of a time, there will be emergencies. So once some untoward incident happen, unnecessarily the acupuncture will be penalized. Yeah, for cardiac, you are doing acupuncture. No, what are you idiot you are? So for no reason, we will be penalized. So I don't touch all those two things. Number two, we treat we take up the patients who are completely 2.5 years old minimum.
Okay.
Less than that, we will not touch. But in the same way, in Singapore, I was very good in painless labor.
Really?
I was an expert in painless labor.
Wow.
They will call us on the second stage. Second stage is the rupture of the membrane rupture.
Yes.
Fluids will be coming out. That time you will call us. Believe me, the needle will be like this. From the lower abdomen, we'll insert the needle and we'll send it up to this level.
Wow.
It's an art. Completely. It should not come out or it should not go in. Just in between the fascia and the skin, we'll be taking it to the next level. Then we'll connect to a electrical stimulator, particularly the little toe,
Yes.
There you got a point called as UB67.
Okay.
I'll put one stimulator there. Completely, you give a stimulation for 2 minutes. Completely, they'll be very comfortable. They'll be, matter of fact, they'll be fighting with the husband. Here, all contractions will be there and you get normal delivery.
Beautiful.
Absolutely, that is possible.
Also, can you explain to us the underlying principle or mechanism you believe are at play in these treatments?
Yes, sir, but take it for granted. Why I give more importance to acupuncture? As an allopathy, how they have taught us is there is a body, there is an infection, you get the disease. So by giving a medicine or a root or a powder or some decoction or tonics, you kill the bacteria. So they become normal. This is a curative science. But I enumerated so much diseases,
Yes.
they are not because of bacteria. That is the reason allopathy plays less role. But the acupuncture, what do they say? When you inhale, not only the oxygen that goes in, it's a prana that is abundantly present in the atmosphere, that also gets in. This is Aham Brahmasmi. That's a universal force that goes inside. Where it goes into the lungs. In lung, you got a collection of blood vessels. This blood and the prana that is coming in, they both join together and there is a production of life force, they say. You come and ask me, doctor, you called somebody, you certify somebody dead. What was in him, you called him alive. And now what left him? Now you are calling him dead. If you ask a question, no allopathy doctor could say, they cannot define what life is. But here in acupuncture, sir, when it goes on, when it mixes, there is a generational life force. This life force has to be taken care completely to all the parts. So to go, they got a channels.
Yes.
It's a pathway. This channel, but nothing will go by itself. That should be a pushing force. So God has created acupoint. So it collects the chi and sends it to the next one.
Okay.
When this deal is done properly, you do not have any disease. When the channel is being blocked and the flow of energy is completely limited, you exhibit, you manifest so many diseases. So because we know what are the points might have been different,
Yes.
God should give me a mind to go over a correct selection of points. And for the clarity in the subject will tell me what are the points to be needed.
Yes.
I take a bimetal. The reason being it, then only there will be electrical discharge. I'll put it exactly over the points which I think might have been blocked. This I will not insert it deeply, only as superficially. I can say not even half an inch. I will put it inside. I'll keep the longer one outside. So there will be, because of the unseen whirling of wind, there will be twitching, constant twitching. You take a grower, you put it inside. You do like this, what will happen? Underground also, likewise, because of the twitching, the block will be released. I regain the flow. So that may be a curative system, but this is a corrective system.
Correct.
So that is the reason I do not have any chronic cases in acupuncture.
Okay.
Sir, 10 years, sir, dried land, no rains, dried land. If we have 2 days rain, what will happen? Third day you can see green. That is Bhumi Dharma.
Yes.
The same way, 41 years of dormant muscle in acupuncture, in polio, it grows. You cannot ask me how come it is possible, doctor. You cannot ask me.
Also, Doctor, I would like to ask you if you could shed some light on how acupuncture can play a role in easing pains or dealing with infertility, indigestion, cancer, migraines, neuro disorders, diabetes, back pain. Is there anything like a mechanism?
So whenever I release a block, automatically it becomes normal by itself.
Yeah.
But certain things, apart from these things which you chatted out, I would like to entertain something about the cosmetic acupuncture. But nowadays, in our own days, sir, in a whole class, out of the 40 students, one fellow will be fatty.
Yes.
What is the reason for that? In our own days, even this idli and dosa, it will be done, it will be given only in festival days, not daily. We used to have ragi, used to have all maize, ragi, wheat, everything will be the routine days. And where even if you hold a car, you are not supposed to go in the car. My father had a car when I was a student. I had to go 2 kilometers to my school. Daily 4 times we had to go and come back. At that time, nobody will give you the lunch and all. We have to come back, have the meal and then go.
Yeah.
Nobody bothers. Even for only when our family goes somewhere for the wedding, my father will be using the car. Even not, he will never use it, he will go by walk. So physical activities, everything is there. Now you think of the junk foods, 0% calorie value, but completely they take.
Yes.
So in obesity, what is the thing? Everybody talks about the deposition of fat. So when you are on fasting, the fat may go. When you do some exercises, it may be burnt out. Yeah, except only 30% is deposition of fat. 70% is retention of fluid, I tell you.
Is it, doctor?
Retention of fluid. Sir, now it's an accumulation of fat. The size may be bigger. But you see the ladies out of 40 plus, when you ask them to lift here it will be flappy.
Yes.
How come? Only there is a fluid inside. It will be moving there. But the fat, the gauge will be more. But it will not be loosened this way. Upper lower abdomen, it will be flappy. In the back, you can see stripes, tires completely. All because of the collection of fluid, retention of fluid. Sarva Dharma, because of the internal heat always there, if we keep on boiling milk, it will become milk over. Yeah. Likewise, within the body, when you don't drain it out for a long time, from the fluid state becomes the oil state. From the oil state becomes cheesy. From the cheese state becomes muscular. So most of the cases, those who are after 30 plus, automatically you can see cheese on and up. So because we know what is happening, from the cheese state, I will make it oil. From the oil, make it to the fluid state, and I make the fluid body to absorb the fluid. We take 21 days here, 22nd day, minimum reduction of 5 to 7 centimeters. The problem is coming from within that we do not know. Actually, sir, you are going with dosa. You send the mixer. But when you keep boiling it from down, what happens? You see holes. That is nothing but the pimple. Very simple. Heat inside. So I will dissipate the heat. I will prevent the production of heat. Automatically it becomes normal.
Can acupuncture help to overcome addictions these
Addictions,
days?
yeah. De-addiction is 100% possible in acupuncture. Matter of 15 days. How bad they are, I'm not bothered. But on principle, I don't do that. Now what happens? Once they become normal, after that, if you go and celebrate with the party, again they become addicted. That is one thing I've seen. Another thing, the family will not believe that he has become normal. One day, if he comes late, oh, you have again gone for the thing, they will irritate him. So this guy will have full meal and they will come and say, Doctor, you got me right, but my people are not believing. So again, I'm going back. About what is the fun in it? When you teach something, you should not get it back. Yes. But it's a habit.
Yeah. Yes, doctor.
Although it is suitable, I don't do that. Yes. It is only self-confidence.
And also, doctor, how do you convince youngsters to come and accept this treatment?
Cosmetic problem is a very number two. They have depression all time.
Yes.
Why nowadays you see more number of suicidal tendencies among colleges?
Schools
very hard
also.
Even the college plus 2 level, suicidal tendency is very common. Because the problem is not with the students, I can say. Only with the parents. Whatever they ask this guy, they go and give it to them. They keep on giving it whatever they ask. For a 5th standard student, it is really justified in giving a cell phone for 1 lakh cell phone. What is it? What they are going to do in the 5th standard? Why they give? Because he asked me, I am giving. Whenever they ask, you keep on giving them. One fine day, they ask, they should not have asked. But when you say no, they become upset. But each and every time when they ask whether it is right or wrong, you should tell them, explain him why we don't give him. You take it from me, my father is very hard to work. Just as we can't walk in and ask something. Why? Why you need him? So this is a very bad thing. And the children, because they are used with getting everything, whatever they ask, when they accept something different. And each and every people, students and youngsters, they think they are great. When they come to the college, everybody will be coming with the same mentality. So they are unwantedly, when they are punished for some reason, penalized, they'll get upset. So my parents saying, sir, when they menstruated, I do not know. But current scenario, believe me, more than 60% of the young girls, they have painful menstruation. Because any depression, it affects the liver. Liver is very important for the smooth flow of chi and blood. So each and every time when they are stressed, automatically liver plays no role. So there will be no smooth circulation. But in the menstrual period, within the 3 days, it has to go. So it works a lot. It skews us. That skewing is the pain you are feeling.
Yes.
That is the reason you keep on taking antispasmodic, but mentally you do have pain. Because your mind is corrupt. That is where the emotional part I talked about.
Yes. Absolutely. You've also highlighted the importance of stringent safety procedures. Could you elaborate on the specific measures you take to ensure patient safety and hygiene during this treatment?
Yes. The moment the patient comes in, we'll give them needle which they have to carry. Usually we go for disposable. In places like India, the affordability will not be that much. So daily it has to be done. So we give them we can sterilize the needle which they give. So it is not one time. They can keep sterilizing. They can use it for 3 days.
Okay.
So we'll ask them to take it to the home, then put it in a box, close it, put it on the idli pan. They heat it. Steam sterilization is the best thing. They can bring it back simple. The moment they come, we'll apply with the spirit, we completely sterilize the area which are going to be needed. Yeah. Then we put it exactly. The most of the time, this is the reason I repeatedly telling the knowledge of anatomy is very important. Yes. Because when you put a needle, you should know what is underneath. If there is any blood supply, where there is any nerve, everything. And that is the reason repeatedly I'm telling only doctors should do. Because they know, because in anatomy, we open up, we have seen everything. What is inside, we know what is there. But for 3 months students, if they go, they do not have any idea about those things. So when they put one needle, finish. Yes. That's the problem. If they put it on the nerve, landing in ptosis or paralysis. So these are things, basic things. Yes. And while taking also, we'll apply the spirit and we'll take. Yes. Exactly all skeptical things will be taken care. Because a lot of people have this fear of he's using a needle on their body, so it could lead to... You are absolutely right, nice question. AIDS. But I tell you, for young children, people who are 5 years old, autistic child, I put 11 needles in the... It will be possible. For ladies, for facelift, we put 12 needles on one side and 12 needles on the other side, the face. If it's painful, will they come? Everybody will run over. No? Absolutely painless. It is not, the gauge will be very thinner, even thinner than your hair. How swift you are, the patient feels no pain. Yes. What do you feel is the biggest misconception about acupuncture? All doctors, they should have a minimum understanding about acupuncture. Whenever I address the Indian medical associations and meeting doctor and telling me everything, they say, Dr. Muthu, whatever you said, very fantastic to hear, but we don't accept. Yeah. I do not understand the concept. Where is the question of understanding? Where is the question of acceptance? When there is a fact, 4 plus 3 should be 7. Whether you accept it or not is 7. So that type of concept should go from out of the doctors. Number 2, for the patients also, they say, oh, when you put the needle, something will happen to me. They are scared about needles and that. Number 3 is that they want instant release. Yeah. The 3 things have to be changed. Unless that has been changed, then only they'll understand. The doctor should be good enough in explaining them and convincing them to come for those things. There is. Yes. But doctor, has the results of a report from acupuncture treatment, do you feel it's necessary to be assessed by someone other than an acupuncturist, like a doctor? In naturopathy BMIS curriculum, one part of it is acupuncture. Okay. So they usually invite 3 times in a year to give a complete lecture to the whole day. Morning 9 I start, evening 5 o'clock completely I'll be detailing them about what acupuncture is for the students. They will conduct seminars. So when I was kept on, when they're telling them what is what, then they came here and they saw what we are doing here. Immediately, believe me, first time in the history of National Institute of Naturopathy, they have made an affiliation with our hospital. Private hospital, they never do. They affiliate only with the institutions, the colleges. First time they have affiliated with me. It's an applaud given to me by the grace of God, by the recognized university which is coming under Ayush. I also noticed, doctor, whenever you do a treatment, you pray. What is the idea behind it? Sir, basically what I argument. Yes. Where is the logic? You take a needle, you are putting it somewhere, you see a result. So I can explain scientifically. There is a few things. Sir, whatever you do, sir, you are in the best cook chef. You pay them 1 crore, 3 crore. Last time, I would like to tell you, a Rotary conference was staged in Bangalore. And they paid the chef, the best chef in Tamil Nadu. They paid him some crores. But not even one dish was normal. Completely went out. Sir, you can pay money, sir. But to get the result, there should be grace of God. I 100% I believe in all those things. Two things, sir. I always think about the grace of God. I will crave for that. Second one, the clarity in subject. Until you got a clarity in subject, you can't do anything. But for God, nothing is possible, sir.
Could you also tell us some of the miracle cases and noteworthy success stories from your...
Even for, I can see that, I couldn't tell the name of the patient. He's a very topmost hero of, suddenly he fell sick. He was taken to one of the oldest hospitals in Chennai. Nothing happened. Then he was taken to a medical-oriented hospital. That also nothing happened. Then he was taken to Singapore for treatment. Completely his face was swollen. He couldn't breathe. After 45 to 50 days of the problem started, I went and met him when he landed in India. The night itself he called me to meet him. When I went there, umpteen number of people, everybody crying. He has got so many files, all medical reports. He cut hold of my hand and told me, "Doctor, I have forgotten my own face." Because for more than 50 years it is like this. I forgot my own face. My whole life was only on my face. He's an actor. Immediately, I asked him only one question. "Sir, were you fasting for some time?" He said, "Yes, doctor." Because I have a little overweight. So they made me to go for fasting. I was on fruits for 25 days. Only on fruits. My treatment, my diagnosis was over. I said, "Don't worry, sir. I got the diagnosis. We'll give treatment. In 4 days, I can make your face normal. Within 30 days, you'll be normal. You can go back for your own profession." He never believed. He said, "Dr. Muthu, you didn't even see the files. We don't see the witness." Sir, no, sir. We go out to the Iridology. Believe me, on the 4th day, completely he got back his normal face. After 37 needlings, he went back to the profession with a folding hand. He gave me money, he gave me one ring. We put it on mine and said, "Thank you so much, sir." I don't say I am a superman than all the people who treated in the classic hospital or Iridology or in Singapore. No, not like that. I don't say it. But that science says only limited things. Our science is entirely different. I asked him only one question: "Were you on fasting any time?" I asked him, "Sir, any doctor?" I said, "No, absolutely no doctor." "How come you make note of that?" This is how acupuncture plays a highest role.
To ask, it is believed that Chinese system of medicines like acupuncture choose you and not the other way around. What are your thoughts on that?
You are absolutely right. Each and every time, sir, when I meet my professors, I used to tell them, "Sir, what a great art. Why don't you document everything and publish it in the medical conference? Then only people will come to know." Universally, sir, so far I would have met 10 to 15 super teachers, gurus, I can say. All the people say the same thing. Whenever I ask them, they say, "Why should we?" "No, why should we?" "Sir, what are you talking about? Such a nice thing. Why don't we? Why should I? If you want to learn acupuncture, you come to me. I don't invite people to that. It's not my job." I was totally taken aback.
Yeah.
Because though they got a beautiful sign, no intention of propagating to anybody. Because I think they feel it should not be get diluted. Even our own Ayurvedic Siddha people, if you happen to read the books written by Agastya, absolutely, completely less understood. You can't understand what do they mean by that. It is written as a Agastya because they don't want it to be diluted.
I also know that you were invited by the Chinese government. What was your experience like back then?
But thank God, sir, 2016, they invited me to China.
Yes.
Particularly, I was there for 14 days.
Yes.
I've been to 4 universities that gave lectures. But very unfortunate, hard to believe me, they are slowly inclining towards Western medicine now.
Really?
Their interest in acupuncture is slowly diluting.
And why do you think that's happening?
Because the customs, cultural disasters. Before 40 years, sir, everybody were on something like that. Ayurvedic Siddha were very popular. Slowly we went into allopathy. That is what happening now. But very sorry to tell you, it is not good. And such a wonderful sign.
Yes.
Even today, I'm reading new books.
Acupuncture can be harmful if practiced without proper experience, doctor. I've heard some close friends and who've had really bad experience with this going through this treatment. So how can we combat and avoid such bad press?
Sir, one thing I tell you,
Mm.
as it is, acupuncture doesn't have any side effects at all.
Okay.
Because if I put it on the exactly over the point, it will have some impact.
Yeah.
If you put it outside the point, you will become a pincushion, nothing more. The best part of acupuncture, you do not have any side effects. That is the reason I shifted from allopathy to acupuncture also. We have no side effects. But the side effects, how it will come now? Because they are unqualified. They do not know what is underlying. At that time, they tend to produce some accidental problem. So many patients, when they put the needle may bend or broken and to go inside. Becomes an emergency. Only surgical intervention can take it out. So I sincerely tell you, whenever you go and meet the acupuncture, don't go and meet the acupuncture at all. You wait outside. You see the patients coming and going. Patients are the best judges. You cannot deceive the patient. They will tell you what the doctor is eating and how is the doctor is eating inside.
You also have a responsibility to pass on this learning you've made about the system of medicine. So what do you think are the challenges and how do you think you'll overcome them?
I started writing in magazines. In the Kunguma magazine, for 26 continuous weeks, I wrote about acupuncture. Then I published one book on that one. So many things I had done. In my YouTube channel, more than 40, 50 things. In spite of that, I couldn't reach the nucleus of the society. That's the one thing. But now I am becoming old. Thank God I know allopathy, I know acupuncture. I got interested in Ayurvedic and homeopathy. Then Tamil Chuvadis, I got a great experience because I was from Madurai. I had an opportunity to meet all the Chuvadis. Then I had a beautiful interaction with my gurus in China. So Chinese Chuvadis. Then I know Bible. Everything, all collectively, it gives me more input for me to treat a patient. If I go, the whole thing will go with me. So what I've done is, I have documented everything. Likewise, I have made an online course. For the online course, I prepared a beautiful thing for 11.5 hours. For 1.5 years, daily night, 8 to 12, I brought the good people, completely shut down the whole show. As if I am taking classes in front of 1,000 people. I took classes. 11.5 hours, completely I have taken up. If I prepared everything, I have given subtitles in English. I have taken the class in English, subtitles. More than 200 PowerPoint pictures.
Okay.
When I am talking about the Meridian 3D presentation, it took me a long time. For the completely editing alone, I spent more than 1 year. Hard to believe me. Now I have approached a pin and a production of app is being done by digital people. Only the app comes. I'll go public.
Okay.
So people, doctors, the minimum qualification, they should be a medical doctor.
Okay.
Wherever they are, they can sit and go into the app. They can download everything. 1 year time. After completion, they'll be given MD degree in acupuncture. Because already I am running a institute called Dr. Muthu Kumar Acupuncture Hospital.
Okay.
And I got affiliation with the Chinese University, Nine Needle College of Shangxi, TCM. This is a place in central China. I got affiliation with them. So we are, because of the affiliated university, I am giving MD degree in acupuncture.
Okay.
In that, sir, clear cut of our clinical trial also. I have taken video of a patient who are stating that one needle, why I have put this needle. Another needle, why I am putting this needle. Everything I have in detail. So it has come out very nicely. So even in my absence, nobody can change acupuncture. So even after 100 years, it will be for the use to the doctor. First of its kind in the world. Acupuncture so far, it has not come in online form. So the app is being prepared.
Right. Okay.
Another 1 month, I'll go for marketing.
Okay. And they do also intern with you?
No, not necessarily.
Okay.
Everything is detailed there.
Okay, doctor.
Sir, for a surgeon, sir, On hearing, you will not be a surgeon.
Yes.
On watching, you will not be a surgeon. Unless you do surgery. Then you get, but here not like that. Putting a needle. So anybody can practice by pressing the needle on their thighs.
Yes.
So no technical. But what are the points to be done? That I have completely documented in my video. So they need not come and say yes after some time. No, not necessarily. They want to come, they can come. They can see all the OP I am doing here. But they can be there completely, they can learn acupuncture because putting the needle, they have to train themselves.
Yes.
Very simple. No techniques. So putting the needle on exactly on what point for what disease. Everything I have documented.
Excellent, doctor. Thank you very much for this insightful conversation and great learnings from you.
But I should personally thank you because this is a beautiful opportunity for me to explain what are all the things I want to tell to the public.
Yes.
Because I want to propagate this beautiful art should go into the minds of the public so that everybody will be benefited.
Yes.
There is nothing that is incurable.
Yes.
In acupuncture, we can do everything.
Yes,
Thank you. By the grace of God.
One thing that is amazing about you, that you are not just a great doctor, but also kind human being.
Thank
And
you.
you also, I know that your vision and that you want to make a difference to people and help them.
Yes, absolutely.
And I'm sure that you're going to be very
Thank
successful.
you. Thanks for the opportunity given to me.
Thank you, doctor.
Thank you so much.